Hello, Mike Colson from Medicare Insurance Counselors. We're going to continue on with our discussion of Medicare Advantage plans. This video specifically is going to delve into the disadvantages of Medicare Advantage plans. Sounds a little funny to say it that way. Now, in a previous video, I mentioned that the two hardest parts in understanding Medicare overall are, first of all, Part D, and then secondly, Medicare Advantage. These two programs, particularly in combination with each other, have seriously complicated anyone's ability to understand how Medicare works. Now, in giving you the pitfalls of Medicare Advantage plans, the very first one is that all the pitfalls that I mentioned in a previous video under Part D, if your Advantage plan includes a Part D plan, that's the first thing you want to do, is to review those pitfalls already done in a previous video. So we're going to go ahead and delve into the pitfalls here of Advantage plans. The first one is if it's an HMO or PPO, not checking to see if your doctor or doctors or your favorite hospital or other medical providers are network providers. Remember that with the bulk of the Advantage plans, which are HMO and PPO, they are network-based plans. So you need to do your homework. You need to know if the providers you're already using are network-based plans, are providers that are in the network, is what I mean to say. The next pitfall that I would encourage you, and again this applies if it's HMO or PPO, is not fully understanding the term managed care. PPOs and HMOs are managed care. The company does the managing in conjunction with your primary doctor. Unlike traditional, or maybe I should say original Medicare A and B, which is not managed care, if you're going to choose an Advantage plan, you need to understand the depth of what managed care means. You have to get approvals to have certain procedures like MRIs or elective surgery. Your primary doctor will need to give you a referral if you want to see a specialist. You don't need those kinds of things when you have original Medicare A and B. Still another pitfall is if it's an HMO or PPO, not understanding the referral process to a specialist. You need to ask specifically how the process works. If your Advantage plan you might be considering is a private fee-for-service, this presents a different challenge to you. Each time you may use any particular provider, you must ask beforehand if that provider will accept the plan and any terms and conditions of payment that the company has. Please notice I said each time. Another pitfall, another thing you need to know is that MA plans are not supplements to Medicare. You have no idea how many times I meet someone that has a Medicare Advantage plan and they refer to it as a supplement. It is not a supplement to Medicare. In exchange for Medicare paying that company $800, $900, or $1,000 per month per person, Medicare is no longer paying on your claims. Your insurance is with the company that you've just chosen. Your Medicare card, your A and B card, your original Medicare card is now useless. Do not look at your Advantage plan as a supplement to Medicare. It's not a supplement, it is your insurance. Another item worth noting is that many people do not understand the cost sharing of any particular plan, Medicare Advantage plan. When I use that term cost sharing, what I mean is what the copays are. The copays can be very substantial depending on where you live and what plan you're looking at. But it's not uncommon for an inpatient hospital stay to have $1,000, a $1,500, $1,800. Again, it varies geographically, but the copays on inpatient hospital as well as other medical procedures that you may need can be substantial, and you need to know what they are beforehand. Another thing I've observed over the years is that many people that have Advantage plans, since the plans change from year to year, they don't review the plan changes. Each year, a person will get, an enrollee in an Advantage plan will get a rather large booklet in the mail. It could be 3/4 of an inch to an inch thick. The sheer size of the book is intimidating. It's written in insurance jargon. It's not easy to go through the book, to read it, and it's not easy to understand it. Understand something, please. It is your responsibility to do that, not the company's. The company sends you that book because Medicare says that they have to do that. So the company is fulfilling the Medicare requirements. It's up to you to read, know, and understand whatever plan changes the company may have. If there's changes in the copays, that's on you to know. If there's changes in the formulary of the RX plan for the follow, that's on you to know that. And there's other things that can change. And again, all of these things are on your shoulders to know and understand. Another item is if your Medicare Advantage plan includes RX coverage, you need to know and review, not just once, but each year, if your specific meds that you're currently taking are covered in that plan's formulary. Remember, those things change each year. So again, this is on your shoulders to know and do this. Another item I'll mention is not realizing that with Medicare Advantage plans, you are giving up at least some of your healthcare freedom. This is usually in exchange for lower premiums as compared to having original Medicare with a Medicare supplement. Your MA plan includes RX coverage, not knowing that you can get extra help. If you're very low income, you may be able to get extra help directly from Medicare, or there are 20 states that have what is called a state pharmaceutical assistance program. So even if you have an Advantage plan, you may still be eligible for either the extra help from Medicare or from your state pharmaceutical assistance program if your state has one. 20 of the 50 states have one of these programs. If your Medicare Advantage plans includes RX coverage, not knowing all the pitfalls that are mentioned under the section that we already discussed on Part D, because there are a substantial number of pitfalls under Part D, and you need to know those as well. Also, not reviewing the depth of your Medicare Advantage plan's network. Oh, folks, this is a big one. Networks are very, very important if you're going to have a Medicare Advantage plan. With very, very few exceptions, if you have an Advantage plan, it's a network-based plan. And this chore is on your shoulders to know if your providers are, the providers like doctors you're already using are in the network, but also it goes beyond that. You need to have an understanding of the depth of the network. What if in the future you're not using a cardiologist now, but in the future you may need a cardiologist? What if there's no cardiologists in the network? What are you going to do? So I have seen networks that are razor thin as far as the depth of providers that they have. This is on your shoulders to know this. So you don't just want to look at to see if your providers are covered in a plan's networks, but you need to have a general feeling of the size of the network. I hope this is clear to you. This is an important one. And remember, you need to do this on an ongoing basis. There's still a few more. Another pitfall is enrolling in an MA plan without knowing and accepting all the differences as compared to original Medicare. Another one is not knowing and remembering the enrollment periods and the disenrollment periods. With an Advantage plan, you're subject to enrollment periods and you have to know what they are. Generally, it's the fall of each year when you can get into a plan, get out of a plan, or change a plan. But there are other times when you may have the opportunity to do that. Still another pitfall is not knowing the plan's ratings. Medicare has a 5-star rating system. It's generally accepted, just like Part D, that you would want to have at least a 3-star rated plan or better. The last one I have listed here is Medicare Advantage plans are not guaranteed renewable. This is a big one, folks. Medicare supplement plans are guaranteed renewable. With a Medicare supplement, the company can raise the premium if they do it equally for everybody. With a Medicare supplement, the only thing that can change in a Medicare supplement, the only moving part is the premium. With a Medicare Advantage plan, everything can change at least once a year, effective January 1. When I say everything, folks, I mean everything. The premium can change, the copays can change, the Part D prescription portion of the plan can change. Every part of it can change. To help you to understand how much it can change, the company has the option not to renew the plan the following January 1st. And this has happened to literally several million people over the course of the last 10 years with Advantage plans. The company does get the option not to renew the plan. They cannot single you out if you had a bunch of claims. They can't cancel you individually, but they can choose not to renew the entire contract with Medicare, which means that everyone that's enrolled in that plan gets a disenrollment letter on October 1st, effective the following January 1st. All of this is explained in more detail in my ebook, Imagine Understanding Your Medicare Insurance Options. You may already have a copy of this ebook. If not, if you do, it's explained in chapter 6. If you don't have it, it's available in the Amazon Kindle bookstore. It retails for $4.99, and maybe you'd like to get a copy. Thank you for joining us in this video.